Hi, everyone. Thanks for joining this morning. Sorry about the delay. We had some behind the scenes work to do to get this started. I'm Jonathan Modi, Lead Communications Officer at the Oregon Health Authority Public Health Division. This is our monthly media briefing to provide an update on OHA's continued response to COVID-19. We will also do a quick update on Monkeypox Hmpxv. Joining us is Dr. Dean Sidelinger, Health Officer and State Epidemiologist. Just a reminder to please mute your audio and use the raise your hand function during the Q&A portion if you'd like to be added to the queue to ask a question. We are granting permission to record one by one. Also, we will provide ASL interpretation later today to go along with the recorded version that will be posted and available on YouTube. As always, this is an opportunity for members of the media to ask questions of our experts. We encourage members of the public to ask their questions during our Facebook Live events. So with that, I'll kick it over to Dr. Sidelinger to get us started.
Thank you, Jonathan. Good morning. I'm Dr. Dean Sidelinger, Health Officer and State Epidemiologist at the Oregon Health Authority. Thanks for joining us today for our October update on the state's continued response to COVID-19. Today, I want to highlight the latest trends we are seeing with COVID-19 in Oregon. I will also provide an update on the status of Hmpxv, or monkeypox virus, in Oregon, including current case information and availability of monkeypox vaccines. Let me begin with the latest milestone in ensuring that all people are protected against COVID-19, including some of our youngest residents. Yesterday, the U.S. Food and Drug Administration, or FDA, and the Centers for Disease Control and Prevention, the CDC, expanded emergency use authorization of COVID-19 vaccine boosters for children ages 5 to 11. The Western States Scientific Safety Review Work Group met last night and affirmed the new eligibility recommendations. That means that as of today, all people age 5 and older are recommended to receive an age-appropriate bivalent mRNA booster dose at least 2 months after finishing a primary series or prior monovalent booster dose. OHA data show that there are nearly 343,000 persons between the ages of 5 to 11 in Oregon. Just before Labor Day, the federal agencies and Western states approved the Pfizer bivalent boosters for ages 12 and older and the Moderna vaccine for ages 18 and older. This week's news is the next step in expanding protection to all ages. Pfizer's booster for ages 5 to 11 is a smaller dose than is currently authorized booster for ages 12 and older. Moderna's bivalent booster for ages 6 to 17 is the same dose formulation as the product authorized for people 18 and older. Vaccine recipients can also mix brands from the ones they used getting their primary series. The newly approved bivalent boosters target the BA4 and BA5 Omicron subvariants, and also protect against the original COVID-19 virus strain. We know that vaccine effectiveness, particularly from infections, wanes over time. The new bivalent boosters that are widely available throughout Oregon will provide better protection against currently circulating strains than the original vaccines. The Pfizer and Moderna mRNA vaccines went through extensive clinical trials before they updated their formulas for the bivalent booster, similar to how the influenza vaccine gets updated every year. Both have been deemed safe. Young people who are now eligible based on their age and the timing of their original series do not need to have had previous boosters to get the new bivalent booster. The boosters are free and no insurance or proof of residency is required. As of today, COVID-19 vaccine providers in Oregon can begin administering bivalent booster vaccine to anyone ages 5 and older if providers have received their vaccine supplies and are ready to serve parents and children. Because demand for all vaccines is typically higher this time of year in Oregon and nationally, and because the first wave of boosters coming to Oregon are based on pre-orders, it may take a little time to schedule your child's booster appointment. We encourage parents and caregivers to make sure their vaccine provider has supplies of COVID-19 boosters and flu vaccine when they schedule appointments. It is safe for young people, ages 5 and older, to get the flu shot at the same time they get their COVID-19 vaccine or booster. We also encourage parents and caregivers to talk to their pediatrician if they have questions. I also want to thank everyone in Oregon who's already been vaccinated and has received a bivalent booster. As of this week, nearly 7 in 10 residents have completed their original series, providing a high level of protection to a large proportion of our population. As of yesterday, more than 259,000 bivalent booster doses have been administered statewide by OHA clinics, tribal and local public health partners, pharmacies, and healthcare providers. All told, 6.1% of all people in Oregon have received the new bivalent booster, compared to 3.5% nationwide. Also this week, OHA updated data on other key indicators for tracking the impact of COVID-19 as we head into our third fall living with this disease. While we are all tired of talking about COVID-19, Oregonians are still getting sick with the disease. My thoughts are with all of those recovering from the disease, caring for a loved one, or mourning the loss of someone close to them. As we reported in September, OHA has shifted resources from daily to monthly reporting of COVID-19 data, allowing us to focus on a wider set of public health concerns, including other respiratory viruses, the monkeypox outbreak, and our ongoing work to eliminate health inequities. Since September 7th, daily reported case counts have fallen in Oregon from a rolling 7-day average of 580 cases as of September 7th to 482 cases as of October 12th. By comparison, CDC shows a national 7-day moving average that is also trending slightly downward. Test positivity, another measure of COVID-19 spread, is down in Oregon from 7.2% reported September 7th to 6.8% reported October 12th. OHA continues its collaboration with nearly 36 communities statewide and Oregon State University to monitor COVID-19 transmission through wastewater monitoring and testing. Wastewater surveillance shows that general declines in viral concentrations since mid-July have begun to taper off, and some increases in infection levels are being detected starting in late September. As we have shared since March, the number of reported cases do not fully show the level of COVID-19 circulating in Oregon. Many people in Oregon take at-home tests, and the results are not reported to public health. Many others are not testing. From tests reported to local public health and through our wastewater monitoring effort, we can still determine that while disease is coming down, there is still a high level of COVID-19 transmission in Oregon. On October 6th, the CDC reported 9 counties in eastern and southern Oregon were in the CDC's medium COVID-19 community level, indicating that those who are immunocompromised or at increased risk for severe disease should consider wearing a mask in indoor public places for greater protection. This is similar to our last update, September 7th, when 1 county recorded a high level of community-19 transmission and 7 recorded community levels that were medium. As of yesterday, OHA data continue to show that the Omicron subvariant, BA.5, remains the predominant strain in 91% of the sequence samples. I would now like to highlight hospitalization numbers. We have seen an overall decrease in the number of hospitalized patients with COVID-19 in Oregon from a peak of 464 on July 17th. As of today, the number of COVID-19 positive patients in hospitals is 248, down from 272 the week prior. The number of COVID-19 positive patients in hospitals and receiving ICU care is still far below the large peaks we saw during the Delta surge in late summer 2021 and the Omicron surge this past winter. As of October 12th, there were 29 COVID-19 positive patients in ICU beds, up 1 from a week earlier. However, hospitals are still straining under disruptions to care during the pandemic and healthcare workforce shortages. OHA remains in close contact with hospital partners in the Oregon legislature on proposals to support healthcare systems to address these challenges. Based on modeling and national data, we also anticipate that seasonal influenza this fall and winter will pose a greater burden on hospitals. The best protection available is a seasonal flu shot, which can be found throughout the state. It is safe and effective to get your flu shot when you get your COVID-19 vaccine or booster. For those who become ill from COVID-19, antivirals remain an available treatment to help prevent severe disease and hospitalization. You can find out about treatments on OHA's COVID-19 website. If you are at increased risk because of your age or underlying health conditions, please make a plan for how and where you will get tested and receive treatment in case you get the flu or COVID-19. Those who don't have a healthcare provider can contact their local health center or call 211 to find a provider near you. I'd now like to provide an update on the status of monkeypox, or Hmpxv, in Oregon. All of the data indicate that its spread is slowing, thanks to the work of public health and our community medical partners, as well as changes those most at risk have made. First, for those who have been affected by monkeypox, people who have had the disease or know someone who has, you are in my thoughts. Although monkeypox does not spread easily, a monkeypox diagnosis can be frightening and create a lot of anxiety. Anyone who has had close skin-to-skin contact with someone who has had monkeypox can become infected. There's no shame in finding out you have monkeypox. A rash or sores brought on by the virus can be very painful, leave lasting scars, and unfortunately can be stigmatizing, particularly for gay and bisexual men or other men who have sex with men who have been most affected during this current outbreak. But as we look to a brighter future in our COVID-19 response, with people in Oregon continuing to get the bivalent boosters and the coming availability of boosters for children 11 and younger, we are feeling similarly optimistic about monkeypox. Make no mistake, monkeypox is still with us. We continue to see new cases every day. As of yesterday, there are 230 presumptive and confirmed cases of monkeypox in Oregon, with illness onset ranging from June 7th through September 30th. The cases are in 9 counties, with 11 in Clackamas, 2 in Columbia, 1 in Coos, 1 in Hood River, 22 in Lane, 8 in Marion, 157 in Multnomah, 1 in Union, and 27 in Washington. About 9% of cases identify as Mexican, 2.7% of cases identify as South American, and 10.3% of cases identify as other Hispanic or Latino, Latina, Latinx. Case counts for Central American residents were too low to calculate a percent. However, the number of new daily cases being reported to OHA has slowed significantly over the last 2 months, with about 10 cases per week in September, compared to about 30 cases per week at the peak of the outbreak in early August. Our epi curve shows that we are at the bottom of the downhill side of that curve, meaning that cases have leveled off at their lowest numbers since the start of the outbreak. This is due to the behavior changes that those most at risk have made, including choosing to be vaccinated. I appreciate all of the great work of community-based organizations and local public health authorities as they continue to get the word out about monkeypox, who is most at risk of infection, and how the virus can be prevented or treated. This outreach has involved sharing information with people in places where they're at higher risk for the close contact, prolonged skin-to-skin contact that can easily spread the virus, including large events and settings where large numbers of people congregate, such as bars, clubs, parties, saunas, and bathhouses. Using new guidance published in September, OHA has encouraged vaccine provider partners to think creatively in planning vaccine events, such as recommending providers work in partnership with community-based organizations or local businesses to offer venue-based vaccine events that prioritize communities most affected by monkeypox, which will make vaccine more accessible and acceptable. Venue-based vaccine clinics are those that occur in spaces or at events frequented by people from communities most affected by monkeypox. For example, OHA and partners have been offering vaccines at large community events, nightclubs, and bathhouses. OHA's guidance also has advised that anyone who requests the vaccine at community-based vaccine events should receive it. We still have a tremendous amount of work to do to ensure that individuals from communities of color receive vaccines at higher rates, as they, unfortunately, are more impacted in this current outbreak. Finally, I want to share a few final words on Oregon's evolving pandemic response. We are now approaching a cadence similar to our public health response to seasonal influenza, with updated COVID-19 shots matched to the currently circulating strains for most of the population. As federal resources begin to shift to other priorities, OHA has begun to close its high-volume vaccine clinics beginning this month. We'll share those closures on our website and on social media and other channels. As long as they are open, the high-volume clinics remain a quick and convenient way to get vaccinated and boosted. The clinics welcome walk-ins or drive-ups in some locations and do not require appointments, insurance, or proof of citizenship. We'll also continue to operate mobile clinics at events with community partners to support priority populations. Pharmacies, community clinics, and healthcare providers remain great locations to receive a COVID-19 vaccination or booster. The Get Vaccinated Oregon tool lets you search for vaccines and boosters by location and vaccine product available in your community. Finally, I want to thank everyone in Oregon who continues to support their neighbors and take care of one another. In addition to being up to date with all your vaccinations, well-fitting masks continue to be required in healthcare settings and can be used in other indoor settings where many of us will be spending more time throughout the winter. For people at high risk, or those who care for or live with someone at high risk, masks worn indoors offer extra protection and peace of mind. And with that, I will open it up to questions from reporters. Jonathan?
Thank you, Dr. Sidelinger. Just a reminder to our media friends to please use the raise your hand function if you'd like to be added to the queue to ask a question, and to mute your audio if you're not asking a question. Also, make sure to identify yourself and your organization when asking a question. And just finally, just a real quick request, just would like everyone to please speak slowly for our ASL interpretation that will be provided to the recorded version of this media availability afterward. Our first question is from Lynn Terry with Oregon Capital Chronicle. Go ahead, Lynn.
Okay, thanks, Jonathan. Hi, Dr. Sidelinger. I have 4 questions, but they're all related to the same thing. And that's this fall, winter, they're seeing kind of a surge in Europe. So I'm just wondering what you're thinking here at the OHA, when we might have a fall surge of COVID, when that might begin, what strain is likely? Is it likely to still be the BA.5? Or are we seeing a new strain that might pop up? Any sense of how bad it might be? And sorry to fling all these at you, but I'm just throwing them all at you at once. And the other thing is, if it did get bad, at what point might indoor mask mandates come back? Thanks.
Thank you, Lynn, for the question. I think we anticipate seeing a surge in COVID-19 cases as we move into the fall and winter, likely mixed in with increased influenza cases and other respiratory viruses that we typically see in children and older adults during this season. We look to our southern hemisphere neighbors to see how influenza spread during their winter, which is our summer. And that usually gives us an indication of what to expect. And their flu season saw more cases than they have in the last couple of years. And we would anticipate that to be true here as well. While we are still seeing a slight kind of decrease in cases, we're kind of not going down very quickly. And our forecasts, both from OHSU as well as other national models, would show that these cases will likely start to increase towards the end of October, potentially through November, with the OHSU forecast showing that Oregon would likely reach the peak of folks in the hospital with COVID-19 towards the beginning of December. This peak is anticipated to be much lower than previous peaks during Omicron and Delta. What we're seeing in terms of variants is that Omicron continues to evolve. And so we're seeing various combinations of mutations in Omicron subvariants. All of these remain incredibly transmissible, so easy for one person to give it to another. Some offer some ways to evade current protection from vaccines and following recovery, but indicate that vaccines and that short immunity following recovery does still offer some protection, even if it's a little less. None seem to be leading to especially more severe disease in someone who gets it. That being said, we know that immunity following recovery from Omicron infection wanes fairly quickly, with multiple people reporting getting sick again within 3 months following their recovery. So we anticipate that folks who were ill early on in the Omicron wave may still be susceptible, especially if they're not up to date with their booster doses. And that's why we recommend everyone 2 months following their primary series or following their latest booster, receive a bivalent booster to offer protection from these currently circulating Omicron subvariants. For those who've recovered from disease, waiting 3 months after they tested positive is a good time window to get that vaccine to offer protection. What we're seeing in Europe is certainly likely to occur here. While we don't see the kind of same pattern where what happens in Europe happens in the East Coast kind of weeks later, happens on the West Coast weeks later, we do know that it does offer some lessons as their cases increase that can give us a preview of what we might expect here in Oregon. We are continuing with our messaging to try and prevent, a huge impact on our hospitals and healthcare system as we move into respiratory season. Being up to date with vaccines, both your bivalent booster as well as your flu vaccine can help offer you and those around you the best protection, while at the same time keeping you out of the hospital and making sure hospital beds are available for you if you need it, following a heart attack, a car crash, or any other reason. We know that masks, as cases increase, offer additional protection, and that's why we continue to recommend that folks at higher risk for disease or complications from disease, such as older Oregonians, those with chronic conditions, those who are immunocompromised, or people who live with or care for individuals in those categories, consider still wearing a mask. And as we see cases go up, likely in the winter, we will probably talk to folks about more people wearing masks in indoor public places because that offers an additional layer of protection. As for mandating masks, we'll continue to follow hospitalizations, hospital capacity, and the impact on hospital capacity and our ability to receive care in those settings. While we don't have a definitive number, we hope that Oregonians will continue to heed our advice that those most at risk will wear masks, will be up to date with vaccines, and that as cases increase, others may consider wearing a mask so that we can hold off on any crisis in our healthcare system and not have to resort to mandates again, because we don't think that they will be as effective, as we are 3 years into the pandemic. But Oregonians have stepped up time and time again and changed their behavior to fend off this virus and to save thousands of lives.
So just a quick follow-up, if you don't mind. So you're looking at hospitalizations as the gauge. Do you have a number like 500 or, they're pretty low right now? Do you have a number? Or is that just, we'll wait and see?
I think we have to wait and see what the situation is on the ground. We know that healthcare workers right now, the workforce is strained with folks having battled this virus for 3 years. Some people have left the workforce. We know that as cases go up, healthcare workers, like the rest of us, are more likely to get sick, and so they may be out while they're recovering from COVID-19. And we know that hospitals continue to provide a significant amount of care for folks with chronic conditions and other conditions that may have been impacted by delayed care or changes in care-seeking behavior during the pandemic. So we have to see what's going on, not just with the spread of COVID-19 and serious cases requiring hospitalizations, but how is hospital staffing going? Are we able to staff our intensive care unit beds and the hospital beds where people get the most specialized care? And are people able to obtain care in hospitals for all conditions? And so we'll continue to monitor that. We continue to receive reports from hospitals about people who are in the emergency department waiting for beds, people waiting to be discharged. And that's why we're working across multiple partners to try and increase some capacity in the system, to try and relieve some of that stress as we prepare to enter a respiratory season, which is likely going to bring more people to the hospital. But I can't give you a definitive number on how many COVID hospitalizations we would see before we would start talking about recommending more people wear masks, or even talking about having that requirement in more settings.
Okay, thanks.
Thank you, Lynn. Next question is from Elizabeth Hayes with Portland Business Journal. Go ahead, Elizabeth.
Hi, thanks for taking my question. Hey, I was just wondering on the uptake level of the updated booster. What do you think of that? How does it compare with the other previous boosters? Is it about where you expected it to be, or fewer people rushing out to get this? And if so, why do you think that is? Thanks.
Thank you. I think, for our vaccine uptick numbers, I really do thank the more than 250,000 Oregonians who've stepped up and gotten that updated booster already. That number far exceeds the number in many other states when we compare it to population, so when we look at the percentage, but it is still much lower than where we need to be. 7 in 10 Oregonians have received at least one COVID-19 vaccine, and we would hope that 7 in 10 Oregonians would also receive an updated booster. And that number is far from that. So I appreciate, the uptick we've seen. I wish it was higher, because I know that having that updated bivalent booster on board offers individuals, their family members, and neighbors the best protection from getting sick with COVID-19, and especially will keep them out of the hospital and keep them from dying. That's why we continue to try and get the word out about asking your primary care provider when you go in for an appointment about getting a bivalent booster dose. Call your local pharmacy to make an appointment to get your booster dose. Walk up or drive into a community vaccination clinic operated by Oregon Health Authority, our local public health partners, and others to get your vaccines. There are multiple venues around the state to get the vaccine. I would encourage everyone to take us up on that. Again, I'm happy with our rate in comparison to other states, but wish it was higher, because I know that having that vaccine on board offers people the best protection and will keep them healthy as we move into the fall and winter.
Thank you, Elizabeth. Just a reminder to use the raise your hand function if you'd like to be added to the queue to ask a question. We don't currently have any hands raised in the queue at the moment. And I'm sorry, Elizabeth, did you have another question?
Yeah, I was just wondering if you have any thoughts on why it isn't higher. Is this kind of what you were expecting, or it seems again, based on previous boosters, maybe this is lagging a bit, but I could be wrong.
Thank you, Elizabeth. I think the uptick for this booster dose certainly has been slower than the initial vaccine booster uptick that we saw when those were available last year. I think part of this is we're heading in, coming up close on the 3rd anniversary of COVID-19. For many people, COVID-19 is not the same presence in their lives as it was prior to this pandemic. People are, gathering with friends and families, are enjoying, going out to eat, Many who were working from home have returned to the office. And for them, COVID seems a little more distant. But what we have to remember is that COVID is still sickening, many people every day. And we still have several hundred people in the hospital with COVID-19 in Oregon. Last week, over 30 people died who had COVID-19 in Oregon. And that is a very high number, much higher than we would typically see with influenza. So for folks, who haven't gotten that vaccine, who aren't thinking about COVID-19 right now, I would encourage them to have this vaccine on board as we move into the fall season. This is a time when we gather with friends and families for holidays throughout the fall and winter, when we want to celebrate milestones that we put off in the last couple of years because we've been more worried about COVID. And being up to date with your vaccines will help ensure that you have protection from getting sick from this disease, and really good protection from winding up in the hospital. This is especially true if you're older or have underlying conditions that could put you more at risk of severe disease. So I think, many people have moved on. Many people have said, well, I got COVID, so I'm not going to get my booster. But we have to remember that protection following recovery is fairly short-lived. And we've seen people get reinfected with Omicron during this most recent surge. So, if it's been 3 months or more since you recovered from COVID-19, you're due for a COVID-19 booster, and I would suggest you get it. I think, having this, vaccine on board before we go into the fall and winter and see an increase in cases is going to offer you your best protection, rather than waiting till we're facing a wall of disease, more overcrowded hospitals, and then getting your booster. Prevention works best when we do it before we need it. And so having vaccines widely available throughout Oregon, now is a great time to consider getting that vaccine to protect you against COVID, getting your influenza vaccine, and celebrating, more healthy fall and winter and get-togethers with friends, families, and loved ones.
Thanks, Elizabeth. All right, just waiting to see if we have any other questions from our media partners here. I'm not seeing any in the queue. We'll just hold for a moment here to see if we have any other questions.
Well, thank you all for joining us and helping to get the word out. I want to remind folks that while COVID-19 is not causing the same disruptions in our lives that it did earlier in the pandemic, that COVID-19 still continues to circulate throughout Oregon. Being up to date with your vaccines, which are with updated boosters now available for every Oregonian 5 years and older, is your best protection as we move into the fall and winter, as respiratory viruses like COVID typically spread at higher rates. Adding a flu shot to your appointment with your doctor or with the pharmacist will also help to offer you protection as we move into the fall. Having your mask handy, a well-fitting mask that fits snugly over your nose, below your chin, and across your cheeks is a great additional tool you can have as we move into a season when we expect to see higher rates of circulating virus. This is especially true for those of us who care for or live with someone who has a higher risk for complications, or individuals who have a higher risk for complications from COVID-19 because of age or underlying conditions. Those masks and vaccines that we've been talking about for several years now remain our most potent tools to protect ourselves and give our bodies the tools that they need to help fight off the virus if we're exposed, or to prevent the virus from even infecting us. So as we move into another fall and winter season, I want to thank Oregonians for the steps they've already taken, for the steps they continue to take, as together we've saved thousands of lives. While we've had staffing challenges and wait times in our hospitals that are not what we'd like, we've never overtopped our hospital system, and this is really due to the great work of Oregonians stepping up and taking action to protect ourselves. So thank you, Oregonians, and have a good day.
Thanks, Dr. Sidelinger. With that, we will close this media briefing. Please let us know if you have any follow-up questions, and we wish you a great rest of the day. Look for the